एकदम सबसे ब्रेक सीट से ऊपर आ गए उठे तो चढ़ के बैठते हम
Good evening, everybody. The UDFA welcomes you all to its webinar today. The speaker for today would be Dr. KANHU Charan Patro, sir. He is a clinical director and HOD of radiation oncology at Mahatma Gandhi Cancer Hospital and RI Visakhapatnam. His areas of interest include neuro-oncology, breast oncology, uro-oncology, sexuology, and brachytherapy, and of course, artificial intelligence. He has extensive experience treating cancer patients, including over 6,000 with radiotherapy and over 1,500 with brachytherapy. Dr. Parker has received numerous awards and fellowships, published articles, and is involved in various professional organizations and initiatives, including founding the Padmanabha Cancer Foundation. He has developed educational resources such as mobile apps and online channels. Sir has also co-authored several publications. These include study on pelvic insufficiency fractures, cemento-ossifying fibroma of paranasal sinus, limb defect restoration, etc. Additional publications focused on re-radiation in gynecological cancer, organ tolerance during re-radiation, approaches to common cancer, and radiobiology of irradiation, including studies specifically on central nervous system tumors. We welcome you, sir, for this webinar.
Hello.
Yes, sir. You can start, sir.
Just 1 minute.
Yes, sir.
Good evening, all. So today I'm going to tell about how the chat GPT and all artificial intelligence helps the society or medical fraternity to do the easy task and easy task so that it will be helpful throughout the lifetime. And slowly it is a evolving subject. Sometimes some things are free, some things are slowly paid, and starting from the PPT presentation to the practice and everything. So I will tell one by one examples. So I am sharing the directly the ChatGPT platform. So what is ChatGPT? There are many artificial intelligence tools are available in the market, which are helping us to making the things easier. There are many neuronal connections, so they conglomerate all the data and give some in a summarized form. So if you see, suppose what is chat GPT? If I write, my screen is visible.
Yes, sir, it's visible.
So if you see what is the chat GPT, it is a conversational artificial intelligence, wide knowledge base, adaptability, user friendly. It gives the training applications, answering knowledge cut up. So it is. So who got the Nobel Prize this year? Nobel Prize in Physics. In 2024. So if you see the Jeffrey Hilton, godfather of AI, who won the awarded the Nobel Prize, and Sam Altman, who is the ChatGPT CEO, he is the one of the student of this Nobel Prize winner. So this and there is some risks, some legal issues, some all those things are available in the ChatGPT with issues with ChatGPT. Let's start. Suppose I am presenting you. I am Dr. KANHU CHARAN PATRO. So how you know about me? What is myself? So you can write. Please write about Dr. KANHU CHARAN PATRO, oncologist. So if you ask, so it will give this data is where is I have done my MBBS, what is my MD, where my DNB, where my clinical expertise, what is the awards I have received, everything. And you can see if you want more, and you can see where it is taken the sources. So this is the our hospital website where it taken the sources. So if you want, I want in the tabular form. So it will give in a tabular form. So category, so you can current position, education, training, specialization. So this is all given by my biodata came in the detail in detail. So suppose you want to convert into the PPT, please download as PPT. So it will give you as a PPT. So when you are asking for a PPT, it will take slightly 2-3 minutes, and this it will analyze the all data. If you download this table, it will come as an Excel sheet. So we have to be slightly patient when you're asking for a PPT. And so what we can do more. So you can ask what is going on. Suppose you are going to treat one patient. So this PowerPoint presentation is ready. You can click here, and your PPT is ready, and it will, you can see it will be get an so my PPT will come in the tabular form. Is it visible?
Yes, sir, it is visible.
So like this, you can download those PPT. Now, then analyze the image. Suppose you have a radiological image, how to analyze that? So suppose I am attaching here a brain tumor. So if you see, this is a brain tumor image, that is a called glioblastoma multiforme stage 4 brain tumor. I just uploaded this. Please analyze. So I have asked the MRI based on the labeling errors, it likely predicts the brain tumor known as a glioblastoma. And I uploaded what are the, it is giving a radiological report to you, enhancing borders, mass effect, edema, location, involvement, clinical correlation, advanced imaging, treatment consideration. Everything it is given by in a tabular form. Suppose I have this patient, suppose one patient having dysphagia, like how to next talk is the how to analyze the symptoms. So patient having dysphagia and 70-year-old and growth in esophagus. So it will key clinical details. What is the differential diagnosis? What is the esophageal triggers? What are the investigations? What are the staging? What is the management? Everything it given in a tabulated form. And so it is not a directly guide answer to you, but it is some gross idea. You can take a second opinion and everything. This is the one of the thing. Now suppose there is a report. I have a I am attaching a report. Sorry. So and next is the my talk is about the analyzing a report. So I am uploading a computer from report. So suppose so this is the one of PET CT report I am uploaded. I have uploaded. Okay, okay, ठीक. So I upload. I'm sorry. I'm uploading one report. One report of a blood investigation. So patient having this blood investigation, this report. Please analyze this report. So according to the serum biochemistry is there, serum creatinine inflammatory markers is slightly raised. So it is given, and all these things, mild anemia, IgM negative, so IgM clinical concern, it is likely dengue fever. So I have uploaded the file, and it given is the all reports that if the patient having dengue and what are the recommendations, what is the clinical consideration. Now I am attaching two reports. I am attaching two reports. I am asking, please analyze. So who's name and everything. So I am asking to compare the reports in tabular form. So see, it is still analyzing. Just 1 minute more. Compare the table reports in tabular form. So one patient of dengue, he has done in October. So now in the November they were given, and it will give you in the tabular form. So this is the things you can see. The dengue IgM is previously positive, not tested, now not tested. What are the tabular form, even also hematology and recommendations. So all how to analyze the report and comparison of the tab. You can download this table also in the PPT form. Now suppose you want to write a book. So I suppose I want to write a book on cancer esophagus. So you ask the chat GPT ki I want to write a book on cancer esophagus. Please give some chapters. So I want to write a book on cancer esophagus. Please give chapters. So these are the chapters. Chapter 1 is anatomy. Chapter 2 is the epidemiology, pathophysiology, clinical presentation. So it is given chemotherapy, target therapy, emerging therapy, specialized topics. So it is given 20 chapters. So this is though when you are going to write a book on this, all these things, so your framework is ready. Now another step I am telling. So suppose you are on to write the anatomy of cancer esophagus. Please write a chapter on anatomy of cancer esophagus. So you will get it is given 20 chapters. Now you you can copy paste and put in the Microsoft Word and make your first chapter is ready. So it is given the lymphatic drainage, semantic intervention, autonomic indexation, physiology, everything, protective mechanisms, everything. Now you can download and all this. So if you want, I want to put the pictures. You can ask the so your chapter is ready here. You can download also. Suppose I want, please add pictures. So labeled diagram also you can so it will give labeled diagram also for you. So it is it made a labeled diagram for C esophagus, thoracic, anything. Now come so write chapters. Now you want to write a review. You want to write a review article. Please write a review article on cancer esophagus management. So so you can write the review article. So yeah, so you can then any doubt is there? Anything you want to change? It is given references also. You can see in the your screens. Anything, madam? Anything you want to anything you want to change, or I will go through like this?
That's good. It's visible.
Visible. Is it okay now for the presentation?
Yes, sir.
Okay. Now I am asking to the thing. Suppose we have a article in a esophagus. I am just attaching an article. There is a esophagus treatment clause cross protocol. There is a called cross protocol. Please analyze this article published. So it will give the primary outcomes, whatever the things. So it is given this analyzed the articles. It is overall survival, pathological response, adverse events, median. Now I want in a tabular form. So this is the cross trial. It is in the tabular form. You can see it is median survival, R0 resection, pathological complete response, in hospital mortality, most common and most common non. So all these things you can see. It is tablet form. Now I want to more analyze about the summary in tabular form. So this is again study design, intervention, comparator, everything it is given. complete, he can, if you want to explain how toxicity was assessed, it can give the, he can also put some questions. Okay, so how the toxicity also given and everything. Now I want to know the criticism. Please tell about criticism. So there is a flaws in the patient selection, tumor biology, but I want in tabular form. So it is giving that these are the 7 summary of criticism. I want tabular form. So this is a come as a tabular form. Suppose there is a called cross trial treatment and magic trial treatment. You want to compare these 2 trials, how the 2 trials work and which is magic trial is good or cross trial good. So can you compare? So it will compare the cross and magic. So what is the intervention? What is the primary endpoint? Median overall 49.4 months in the cross trial, 24 months in the magic trial. So you can compare. So I want in a PPT. Please download as a PPT. When you are asking for a PPT, so PowerPoint presentation is ready. You can see the PowerPoint presentation. So so this is the PowerPoint presentation, cross trial and magic trial. You adjust the according to your need and everything. Now comparison. So suppose I want a brain MRI. I will upload a report. I'm uploading an image. Please write a radiologically report. So this is a radiological report, but if you want more detail, so it is happening mass effect. So everything radiological report also it is possible. Now, suppose you are going to present something. This cross trial again I am putting. Please make a sorry. I want to make a journal club presentation from this article. I want to make a journal club presentation from this article. Make a PPT. So it will give number of slides. So if you ask now, please. download as a PPT. So whatever the suppose if somebody asked one of your friend asked please download as a PPT. So when I need an article about this, it hardly takes 2 to 3 minutes. So download the presentation. So for journal club your PPT is ready. So the journal club PPT is ready. Now I want to analyze the survival of the please analyze the survival of these patients. No, 1 minute. Okay, some error has happened. So suppose suppose you want to open a company. Suppose I am a oncologist. I want to open a hospital for cancer care. Please suggest a logo. So this type of according to your input, it will give the outputs of the various logos. So many more things it can happen. You can write medical books, oncological books. You can do the plagiarism checks. Suppose I am here attaching. I have written a book, sorry, chapter. Please, because I have taken copy paste from different persons. So I want to plagiarism check and refresh. Please refresh. Sorry. Sorry. Now I am you can do the plagiarism check and everything. Suppose I think somebody, apart from the academics, suppose I think Dr. Lalima, madam, everything is okay. Anything you want, madam?
No, sir, it's fine, sir. Everything is fine. It is visible also.
Okay. So, suppose apart from the academics, so I will just ask. Suppose you suppose it is your birthday, Lalima, madam. I will ask. Please write a poem to birthday wishes for Dr. Lalima. So, you can see it is written this all these things very nicely to make a made a birthday wishes. And if you want any form anything, ChatGPT is fine, but you keep remembering it is a 85% accuracy. It is not 100% accuracy. There are many articles it is showing 85% accuracy. And you can do the birthday wishes, poems, books, stories, medicals, n number of things it is possible. But because this chat GPT, I paid around to 2000 per month. So it is giving analytical reports and everything. But if you want to do it free of cost, it is not possible. Only three attempts are free of cost. Suppose somebody does not want to pay or something, there is a called perplexity. So I'm stopping the sharing. Just sorry, there is important calls. That's why I didn't do that. Anything? So that is all my presentation, madam. Anything you want to know, madam, or any group of people you want to know?
No, sir. Is there any questions from the audience? Can audience please ask questions if there are any?
I have received a question, ma'am, and which I already put it in the chat box.
Okay, can you please share ask the questions on the
Replace journals like up to date NEJM. I don't think it is a replace, but sometimes it cannot replace all those things. I think it is 85% accuracy only. So I don't think it is a replace. But some types of some variations we are all in the evolution process.
The only question I have received from the delegate, sir.
Okay, ma'am. So can you tell us something about prompt engineering, please?
Ma'am,
Because we have undergraduate students also and postgraduate students also. So I think some briefing for prompt engineering to the undergrads also.
two things, madam. I am not a software engineer at all.
Okay, sir.
Okay, just I know the applications in a medical practice.
Okay, sir.
So because I am most of the times I go outside to present something, so I know how to present and all this. But prompt engineering, machine learning, yes, सब चीज मेरे I cannot tell properly. But it is sorry, I cannot answer your question properly.
No worries, sir.
That is the only thing application we should know. But prompt engineering, because those are interested in the software development and all things, they can go ahead like this.
Okay, sir. Mamata, are there any other questions from the audience?
Yes, ma'am, I'm checking. No, ma'am, no more questions, ma'am.
Okay, okay. So we'll wind up the webinar for today. I would request Dr. Yagika to please, our national spokesperson, to please give us a vote of thanks to the audience and to sir also.
It is a useful, and I think I didn't waste your time, I feel.
No, no, sir. It was new horizons for me also to learn. I've been using AI for a long time, and to learn all these new things were also enlightening to me.
Okay, okay.
Good
Yes, sir.
everyone. My name is Dr. Yagika Parekh. I'm national spokesperson for UTFA. I am truly humbled to be part of this wonderful and enlightening discussion. And on behalf of our organization, I would like to express our sincere gratitude to our respected guest, Dr. Patro, who is Clinical Director and HOD for Radiation Oncology. I would also like to extend my thanks to Dr. Lakshya Mittal, who is National President for UTFA, and our coordinators, Dr. Lalima Gupta and Dr. Ashish Gaurav. And a big thanks to all the participants for their presence. Sir, this was truly an enlightening discussion. Thank you so much. Thank you so much.
Thank you so much,
Thank
ma'am.
you, sir. Thank you, everybody.
Thank you all.
Thank you, sir.
Thank you so much, ma'am, for giving us this opportunity to host this session. So now, with all due permission, I'm closing the session here for today.
Okay.
Thank you.